about a week ago, in fact, it was a week ago today, I said we're weeks, not months away from moving into a second phase. On Friday, I said we're days, not weeks away from announcing that movement into the second phase. So today, we are announcing our efforts to update our stay-at-home guidelines and begin the process of moving into phase 2. That process will begin later this week. On Thursday, the 7th, we will put out the guidelines. If the guidelines are met and modifications are made, then people can start reopening with those modifications in these particular sectors as early as Friday. But again, the modifications, the adaptations need to be in place before we can move into that second phase. But it can begin as early as the end of this week. Here's the phase that we will be moving into later this week. We mentioned phase 2 included an earlier and a later consideration, meaning low risks and moving into a little bit medium to higher risk as we phase into these 4 phases. I know this can sound confusing, but lower risk is, again, the frame around this phase 2. And lower risk, we are defining in the retail sector, and we'll be making adjustments this week in the retail sector for pickups and for all of the associated logistics and manufacturing related to retail. Let me be more precise about what I mean by retail. As early as the end of this week, you will have the capacity as a retailer with the modifications and the guidelines we set forth on Thursday to begin to reopen for pickup clothing, bookstores, music, toys, sporting goods stores, florists with Mother's Day coming up, other sectors, or rather other businesses within that retail sector, and the supports and the accessory support on logistics and manufacturing within and around those sectors will be allowed to move forward into this phase 2. We are also allowing, with considerations of additional criteria, the ability for containment plans and protection plans to be put into place in regions and counties throughout the state of California where we recognize there are different conditions and we believe different criteria should be put into place. So we are also announcing today the capacity for these other counties and regions to move further into phase 2 with plans that need to be locally certified, with plans that need to be locally certified by criteria that includes the capacity on testing, the capacity on tracing, their capacity on physical distancing and sanitation, and their capacity to protect the most vulnerable residents in their community, particularly seniors in congregate facilities, those that are incarcerated, those that are homeless, and other individuals. If those criteria can be self-assessed, self-certified by the local health official in concurrence with the county supervisors, can be self-certified, attested to, in concurrence with the local health official and the county supervisor, we will allow additional movement through phase 2. And so that includes, let me be specific, the prospects of restaurants with modifications opening, hospitality more broadly opening again with modification. Not into phase 3 yet, but well into phase 2. Primarily in that restaurant space and other specific capacity. Again, it has to be done in a very thoughtful and judicious way. It's a health-first focus. Indicators have to be maintained, and Dr. Angel will talk about what those indicators look like. Stabilization on rates of hospitalization in ICU or over 14 days or declines, and again, testing and tracking capacity. But one thing I know very well is many of these counties, many of these regions have done already a ton of work in this space, and they're ready to go. And so I have great expectation that you're going to see a lot of these communities with local certification in place. All of those will be made public. All of those have to be done through a process that goes to the California Department of Public Health, where that attestation and that attestment at the local level certification of all those conditions and criteria from a health frame are going to be met. Once that is done, we need active monitoring, surveillance to make sure that the disease is not spreading. If it is, one of the criteria is a trigger to remodify the changes. And so we just want folks to know we need to toggle back and forth here on the basis of what's happening in those communities in real time. I know this, trust me, I know this can sound very confusing. But let me just, again, before I bring up Dr. Angel, who will make it much more simple and has slideshow to reinforce that, just make this point. We are entering into the next phase this week. End of the week, with modifications, we will allow retail to start operating across the spectrum. We will allow regional variation, but only after self-certification of particular criteria that will allow even further implementation of our phase 2. This is a very positive sign, and it's happened only for one reason. The data says it can happen. But we recognize as we begin to modify, behavior is modified and possible community spread may occur. If that's the case, and we do not have the capacity to control that spread, to trace that spread, to track that spread, to isolate individuals that may have been in contact with COVID-19, we will have to make modifications anew. And so this is a sober announcement. It's done on the basis of health directors in local communities guiding our effort here at the state. And I just want to thank everybody for their collaborative spirit and their hard work over the last few weeks of really putting these modifications to play. One final point, and then I'll pull it over to Dr. Angel. We are not telling locals that feel it's too soon, too fast to modify. We believe those local communities that have separate timelines should be afforded the capacity to advance those timelines. So let me unpack that. For example, the Bay Area, Northern California, they have guidelines where they are a little more strict than these guidelines. If they choose not to come into compliance with the state guidelines, they have that right. Others, because conditions are very different in the Bay Area and other parts of the state and more rural parts of the state, and Northern California as an example, they may want to go even further. Again, we will afford them that right with conditions and modifications that meet the health needs of the entire state. Because one thing we know is none of us are isolated. We may be more so in terms of our proximity to others, but none of us are immune or isolated from people traveling within and without, out of these communities back and forth. And so we have to manage this from a broader perspective, not just a very small perspective, but we do nonetheless recognize the variations and the diversity across the state. And so thus the ability to go stronger or to modify and begin to loosen up even more. So that hasn't confused you a little bit. You haven't been paying attention. If it hasn't confused you a lot, well, the good news, I hope to ameliorate that confusion and concern, because we have Dr. Angel that will, I think, more succinctly put all this in perspective and has a slideshow to back that up. And of course, we'll answer questions for additional clarification. But this is an optimistic day as we see a little bit ray of sunshine on the horizon. Adaptation, modification, first and foremost. But as you'll see with the report card that Dr. Angel, our health report card that we're putting out today, why we're in a position to make this announcement. Dr. Angel?
Thank you, Governor. It's a pleasure to join you again to talk about this very positive opportunity that we have moving forward here. And again, this is because the data tells us that we can, but that data is only a reflection of all of the hard work all of us here in California have done. All of those people who've stayed home, all of those people who have worked in our essential workforce to make sure that we can stay home safely. That's why we are where we are today. I want to start first with a reminder about our specific goals as we move forward through this process. Until California is protected, until we have immunity, meaning that it is safe for us to move without modifications, we will keep 4 things specifically in mind when we make our decisions. First of all, we want to make sure that no matter what we do, we maintain and ensure our ability to care for sick within our hospitals. Making sure that our care delivery system is protected is essential as we move forward, particularly into this point. As the governor said, as we begin to move forward, to move out of our homes, we increase the risk of people getting sick. And when people get sick, we want to make sure we're there to protect them. We also are very focused on making sure we prevent infection in those people who are at high risk for severe disease. We are clear that we need to build the capacity to make sure that we're continuing to protect the health and well-being of all Californians. And then ultimately, we are focused also on making sure we reduce the social, emotional, and economic disruptions that are occurring based upon this very important stay-at-home order that we put into place, which is one of the reasons why we are so pleased to be able to talk about moving forward and opening some areas of our sector with modifications because the data tells us so. And so the report card that the governor referred to, I'm going to share with you now. Here specifically, these are based upon the key indicators that we have always discussed in our roadmap, but there are specific metrics related to those indicators that are particularly important as we talk about moving from stage 1 to stage 2. So those key areas, and we've mentioned them before, I'm going to mention again and talk to you a little bit about how the progress is in each of them that brings us to this point where we can make these exciting announcements that we're anticipating the potential to make some changes as soon as this Friday. So first of all, the key metrics include stability of our hospitalizations, personal protective equipment inventory, making sure that we have healthcare surge capacity, that we have testing capacity, that we have contact tracing capacity, and that we have public health guidance in place. And with all of those indicators, we are on track. So how? So first of all, with respect to stabilization of hospitalizations, this is a graph that we've showed you. This is how we're understanding how it's affecting our state at large. We're looking at the number of hospitalizations of people who have COVID-19. Across the top is over the past 14 days, the trend in the total number of people hospitalized with COVID-19. And across here, the second lighter line shows the trend in the total number of people hospitalized in ICUs with COVID-19. And you'll see that's a pretty flat line there. It's stabilized. We'd like to see that. It even looks like it might be going down a little bit, but that's cautious optimism. Regardless, it has been stable, and that really supports making these decisions. But there are important other things that we need to take into consideration that are also on our report card. With respect to personal protective equipment, PPE, incredibly important as we move into this next stage. So on hand today, we have over 18.2 million surgical masks, 5.8 million face shields, and 7.2 million gloves. We will be and are distributing those rapidly to our local counties and health facilities and other locations where they are needed. And we have also ordered and anticipating hundreds and millions of surgical masks and N95 masks that should be coming in. So we're progressing very well in that. With respect to surge capacity, we have 14 facilities statewide that are ready to accept patients. This is outside of our traditional care delivery system. That's a total of over 2,072 additional beds that are ready to accept patients if we need to use that space. We also have 10,000 plus ventilators throughout the state that are not in use and available to respond if needed. And we have 94,000 applications received to date from folks ready to join applying to join the California Health Corps. That's an additional workforce that we can use to help support additional needs throughout the state if needed. So our surge capacity is in really a good place. With respect to testing, we are growing our testing capacity. You hear about this virtually every day. We have met our goal of 25,000 tests per day. And we have 86 new testing sites statewide that are going to be focused on both rural and urban underserved areas to make sure that we can address testing needs. Those are rolling out. They should be out soon. Again, this gives us optimism that as we're moving towards the end of this week, that we will have testing that will be necessary for this early stage in place. Of course, we continue to grow our testing facilities across the state because we know that's of vital importance. So we will continue to focus on this. Now that, and as I've just shared with you, we're in a good place to start talking about this move. So let me talk and reiterate a little bit of what the governor had mentioned earlier, specifically that we have been focused now on stage one. As you know, stage one is our essential workforce, and during this time, we've been really focusing on making sure that that workforce is safe and secure. We will be anticipating moving into stage two, but we're going to do so in a way that's measured and thoughtful. And in order to do that, we are going to start moving into stage two this Friday, we believe, and it will only include specific industries. So just to reiterate which industries this very first part of stage two will include, it is expanded retail with curbside pickup, and then associated manufacturing and supply chains for that retail. What does that mean? Well, it means other retail places like bookstores, clothing stores, florists, sporting goods stores, all of those will be available and open for curbside pickup, along with all of those individuals who are working in manufacturing related to those types of areas now will have the opportunity to go back to work. But remember, this is with modifications. That means we want to make sure that both the workers and the customers are safe in these settings, which means that there will be modifications to ensure physical distancing and making sure that the unique circumstances of those workplaces will be addressed. And so for that, guidance will be coming out this Thursday to provide additional information and assist industries that are making those changes to make sure that all of us are safe as we move into this early next stage. So what's not included in this early next stage, but still is in stage two, in this very opening, we're not going to go immediately to opening offices, for example. We're not going to go immediately to seated dining at restaurants. We're not going to be opening shopping malls at this time. We're going to start with those sectors that I just mentioned. These sectors, however, will be a part of stage two, and you can look forward to us sharing guidance and announcements on when it will be safe to open them. Again, remember, we're following the data and we're looking very carefully at this. We're going to move as rapidly as we can, but as safely as we can through stage two. Regional variation, I know, has been a really, really important topic. I've been on the phone and in contact every single day with our local health authorities, really understanding their local conditions, understanding regional conditions, and getting really guidance from them. We're learning from one another constantly over this process. And so we're excited to share with you now a process in which counties can request or attest for a variation during stage two. That means that counties can move more quickly through stage two, but only if they attest that they've met specific state readiness criteria. We're going to be sharing those readiness criteria later on in the day, but they follow very much the indicators that we've talked about earlier. Really, they're all those things that we as a state and in conversations with the local counties really understand are important, that they're in place in order to make sure that we move into this next stage in a way that minimizes risk. So counties are going to create and submit these readiness plans, and then those will be made publicly available online for all of us to review and see and understand how those counties that are maybe moving in a different rate through stage two, how they are planning to make sure that the risk is minimized for all of their residents. And then I just want to go a little bit into contact tracing again. This has been one of our key tools as we think about moving into stage two. It's important because as people move more, we increase the risk for people to get sick. If people get sick, we want to identify those individuals very early and then make sure that all of their contacts are also identified. In doing that, we can create a way to minimize the spread of COVID-19 if it enters our communities and allow us to continue on safely with continued movement through staging. So contact tracing is incredibly important. To speak specifically about where we've gone with respect to progress of developing this very important infrastructure, we are identifying up to 10,000 individuals who will be contact tracers and available across the state. That's through the first phase. When we hit 10,000, we're going to go for another 10,000 more. We'll be redirecting existing state staff, so we don't necessarily need to bring in an entirely new workforce at this moment because we have lots of people already available to do this. Staff will be requested by and then assigned to local health authorities. And the model is designed to be scalable. So we can start in one place and very quickly build it up so that they have the resources that they need if indeed there is a number of cases in a place where a county needs additional contact tracers to make sure that they're able to control the COVID-19. The training is going to be done through a virtual training academy. This training academy will be available to individuals throughout the state. It will be high quality and free training not only to the individuals, but also available to all health departments free of charge. So this is something that is a service to our state across any county and will be available there to make sure that every county can build up the resource that it needs to make sure it protects their community. And then finally, there's also included in this a data management platform. That's going to be available, again, to all local public health departments without charge. It's going to have a very heavy emphasis on health. Those are the questions that we're asking about. That is the information that is important in this context. It's not a broad database of all of an individual's personal information. It's really focusing on that health information that's needed to protect and to control this specific case of COVID-19, and it is absolutely confidentially managed. The data platform itself is going to support both the case investigations and the contact tracing itself. And it's also going to be interoperable, which is incredibly important so that it can the information can move seamlessly with our disease surveillance system. And it'll also support system checks via chat, email, phone, automation, making it really easy for individuals to be able to share the information about how they're doing with those in the county that are helping support them in either isolating or quarantining, depending upon whether or not they have a case or they might be, have COVID-19 themselves, or whether or not they're a contact of one and being managed very closely to make sure that they're safe and healthy.